Have you ever think about who calls for death? A study of 2,300 rescued heart patients in the United States found that people with hostile personality traits such as bidding, pessimism, anger, impatience, or irritability were more likely to have a second heart attack 2 years after a heart attack and die. Researchers believe that this is probably due to the fact that people's emotional state can affect their health. Scientists from the University of Tennessee in the United States examined the health status of 2,321 survivors of a heart attack. The level of hostility was assessed at the beginning of the study with the help of a standard personality test, and then these individuals were monitored for the next 24 months. Subscribe our YouTube channel to watch the rest of this video and more. At the end of the second year, participants' survival rates were compared with their score on the personality test, and they concluded that a hostile personality trait could accurately predict the likelihood of dying from a second heart attack. Researchers in the European Journal of Cardiovascular Nursing wrote that a person's personality can affect his heart through both behavioral and psychological mechanisms. People who were hostile and arteriosclerosis for a longer period of time had adrenaline, cholesterol, and triglycerides and a higher than normal heart rate. These are inflammatory factors that can trigger heart attacks and reduce a patient's clinical condition. Previous research has shown that optimism has a direct effect on heart health, as it reduces stress hormones in the body, heart rate, and blood pressure. Also, people with a more positive outlook eat healthier, exercise more, and are less likely to turn to drugs. People with a warm temperament are more likely to quit smoking and more likely to quit if they are already a smoker. Scientists also believe that people's general mood changes the levels of harmful and beneficial hormones in the body. For example, optimism lowers stress and anxiety hormones such as adrenaline and cortisol. These hormones place a heavy load on the heart and can raise blood pressure. The author of the article, Tracy Vittori of the University of Tennessee, says, being hostile is a personality trait that includes being pessimistic, impatient, or quick-tempered. Personality trait is the way people interact with others, so it does not mean that hostility happens once. We know that controlling lifestyle habits can improve the outlook for heart patients, and we now know that one of the things that can be done is to improve hostile behaviors.